Think back pain means you should rest. Think again. Here's what really helps. When your back is aching, your first instinct might be to hit the couch and avoid movement altogether. After all, rest helps you recover from other injuries, right? But when it comes to back pain, too much rest can actually do more harm than good. Surprising as it sounds, staying active, with the right kind of movement, is often one of the best things you can do to speed up recovery and prevent future issues. The rest trap. It's completely natural to want to lie down when you're in pain. But here's the catch. Prolonged bed rest can cause your muscles to weaken and stiffen, your joints to lose mobility, and your recovery to slow way down. In fact, studies have shown that people who remain active during episodes of back pain tend to recover faster and experience fewer long-term problems, and those who stay in bed. While a day or two of light rest may be helpful at the very beginning of an injury, continuing to avoid movement beyond that can delay healing. The key is gentle, guided activity that keeps your body mobile without overdoing it. What really works? So, what should you do instead of lying flat on your back? Here are a few evidence-based strategies that can actually help relieve back pain and improve function. Stay active within reason. Low-impact movement like walking, swimming, or even light stretching can promote circulation and help reduce stiffness. Movement encourages the flow of nutrients to your spine and muscles, which is essential for healing. Stretch and strengthen. Gentle stretching can relieve tight muscles, especially in your lower back and hamstrings. Over time, strengthening exercises, particularly for your core, can provide better support for your spine and help prevent future pain. Mind your posture. Poor posture is a common cause of back pain. Being mindful of how you sit, stand, and move throughout the day can reduce strain on your spine. Try to keep your spine neutral, shoulders relaxed, and feet flat on the floor when sitting. Heat and ice therapy. Applying heat can relax tight muscles and improve blood flow, while cold packs can help reduce inflammation and numb sharp pain. Use what feels best.